FCT? How is the management going on? What are we supposed to do? What are we supposed to listen to? What are the basic rules and guidelines that is going to make our life more effective? And there is no other person than my brother here in the studio, Dr. Muhammad Kau. You're welcome to the program.
Thank you. Welcome. Good morning, listeners.
Good. That's very good. He is here to give us the nitty-gritty, the briefs that we should listen to. And to you, our listeners out there is something I want to say about us Nigerians. The government has put in place institutions. The institutions churns out terms, rules, guidelines, policies for us to follow. And I keep saying this on a regular basis. We should make sure whatever we are listening to, we listen well. Whatever policies and guidelines are thrown at us, let us listen well and adhere to them. My brother, Dr. Kau, let us even start from the basic brass tacks. COVID is with us. There is no gainsaying about that. And then we are trying to mitigate it. The Ministry of Health is doing its bit, the NCDC is doing its bit, the Fcta is doing its bit, for which you are the arm of the Fcta that is really doing this bit. Kindly, for openers, kindly tell Nigerians about this COVID and the basic rules of what they should do for starters before we now go into the nitty-gritty of the facts and figures. Please.
Thank you, my brother.
You're welcome.
Mr. Bakare. Yeah. As you've said, COVID is here.
Yes.
And it's likely going to be with us for some time.
Of course.
And unfortunately, it's a pandemic. It means it's all over the world.
All over, it's global.
So there's no way you run and say you're going to go and hide. Yes. The most important thing, as you said, is for everybody to take personal responsibility.
Of course, of course.
You must believe, you must come to reality that COVID is real and is here. You should also know that it's coming in waves.
Yes, yes.
And as you said, this is the fourth wave. And there are so many variants of this COVID-19.
Yes.
From Beta, Delta, now we are on Omicron. But they are all COVID.
Of course, yes.
It's like saying cows, the different types of cows.
Yes.
And so they are all COVID. And the basic principle is the same. Most importantly is to ensure that we cut the spread. If it's not able to spread, it remains with one or two people. The wave will definitely die down.
Of course, of course.
The wave will definitely die down. So, what is important for us is to ensure that we cut the transmission. And cutting the transmission is, most importantly, is ensuring that we do the basic non-pharmaceutical preventive measures.
That's it. That's it.
They've been summoning for the past 2 years or so.
Yes, since 2019.
Yes, since 2019. And we must continue to do that until we reach what we call herd immunity.
Yes, yes.
Herd immunity means more than 80%, 75 to 80% of the populace must have reached immunity.
Yes.
So
yes.
it means the virus can no more spread into the community, into the society.
That's right.
And the best way is through vaccination.
Of course, of course.
Or you allow it to naturally develop the herd immunity, which will take much, much longer time.
Of course.
But thank God that vaccines have been developed and that all countries are vaccinating.
What's left is just the vaccination of the people.
Vaccination. And the vaccines are available in this country. They're available in FCT. And there are so many centers available for people to get vaccinated. The government is even getting to a level where it's pushing people to get vaccinated by making policies that will not allow you to enter certain government or public places
Yes. Yes.
without evidence of vaccination.
Vaccination.
You are aware?
Yes,
Most
very
countries
much so.
of the world do not allow you to enter their country without showing certificate of vaccination.
Oh, of
So
course,
if you
yes.
get to a level in this country where for you to enter a mall, for you to enter a bus, you must have evidence. The fact remains, even if you don't protect yourself,
You have to
you
protect
have to
the
protect
next person.
The next person.
Yes,
That's the issue.
that's true.
The issue, you can decide, say, okay, I don't care. But you must be kind enough to protect the person
The next person
who cares.
who cares about his own life if you don't care about yours.
Unfortunately, probably you are a young person who has very good immunity,
That's right.
but the next person is fragile, probably elderly, probably has common-
lower
yes,
immunity.
low immunity. So that is the principle. So what we will continue to emphasize, especially as we are entering New Year, we're just coming out of the Christmas
Period. This festive period,
Yes.
everybody is traveling up and
is
down.
for us to be responsible. And the motto this time is celebrate responsibly.
That's a good one. That's
Yes.
a good one. Celebrate.
Yeah, nobody-
Nigerians, are you
yes,
listening to him?
yes.
Celebrate responsibly. That is
Nobody
that
will
is the
stop
slogan.
you from celebrating,
Of course.
but
of course.
celebrate responsibly.
That's good.
Ensure that if you are going to a place that you face masks, you maintain social and physical distance, you have your sanitizer, or the church or the gathering has a place where people can easily
wash their hands and then
maintain some
social distance and,
yes, yes, and continue to enjoy.
Thank you very much. You've been able to give us a very good, broad, general knowledge. But I would like us to do one thing. Since you are in the FCT, you belong to the FCT administration, let's localize what we are talking about. Fair enough, you've been able to make some insights and incursions into questions I wanted to ask you in terms of the people and the season itself. You've touched on it. But let me run some figures by you. As at November in FCT, we had 252 cases. In December, barely 1 month, 4 weeks afterwards, the numbers became 2,591, which is over 1,000%. I know you were doing a good job of trying to maintain and curtail and mitigate this thing. What are the other things? What are the other parameters that are in place? Though you've said some of them really, but I want you to repeat them. That because there's always that level of repetition for emphasis. The time the people hear it on and on from you, most especially from you and your department, they will learn more. Again, I'll repeat myself. There is a very high surge from November to December. What is the FCT doing in this wise?
Yeah, thank you very much.
You're welcome.
You have heard the minister has issued a statement just before the
holidays.
The holidays that we must continue to maintain the normal non-pharmaceutical preventive measures
Yes.
that are already in place.
Of course.
Number two, that all recreational areas, worship centers, churches, mosques, we must maintain 50% of the capacity of those places.
Yes.
We must ensure that we do what we call responsible celebration of
this period.
This period. And most importantly, I think what we try to do is to ensure that people get vaccinated.
Okay.
We continue to sermonize this vaccination.
It's important.
Because
it's
that
highly
is
important.
because that is the intent. At the end of the day, if all of us get vaccinated, or most of us get vaccinated, we develop immunity. So even if the virus is available, it's not likely going to spread. You see how it surges more than 2,000%. And that is normally what happens with the viruses of this kind of virus, especially virus that goes through the respiratory system.
Yeah.
It's very
easy to spread.
You
and
sneeze,
mutate.
you throw it all over the place. You come and sit down innocently and you touch it. By the time you do it like this,
you're infected.
Yes. So that is what we continue to do. Even the Secretary of Health and Human Service Secretariat also issued a warning or a concern when they realized that most of the directives, the protocols that were in place were not being obeyed.
That is the problem of us Nigerians. We don't listen.
Yes, the way government expected. In fact, he threatened that they were going to put more restrictions. We are watching. If it continues the way it's going, most likely we're going to have more restrictions. Certainly, people should not misunderstand me. I'm not saying lockdown. I'm saying
restrictions is different from lockdown.
Different from lockdown.
Okay.
No lockdown, but we are talking about restriction.
Yes.
Restriction in terms of weddings and
large gatherings
and all those things. You know. So these are the things FCT is trying to do. And it's not only FCT. That is what the federal government has also decided to do through the Presidential Steering Committee. And we've had recently there are even so many areas where
Let me throw another question at you. In terms of, I know the FCT is doing a good job, and then that is your purview there, and then you're making sure that we adhere to these non-pharmaceutical protocols. But at the same time, what about the primary health centers that the Abuja FCT has in place? How are they equipped? Are they properly equipped? Are they ready for the people in terms of testing and vaccination?
Yeah, I can tell you. I will share the PSCs that have vaccination centers.
Thank you very much.
Almost all the PSCs have vaccination centers.
Okay.
And we have gone beyond that. We are at a level where we call mass vaccination. Mass vaccination sites have been opened. The big malls. All religious centers, big churches.
That's good.
In fact, high volume areas have all been designated as vaccination centers.
Oh, that's good.
We want to take the vaccine nearest to the people, so you don't have to struggle. You don't have to
travel or go too far.
Or too far to go and get vaccinated.
Oh, that's a good one.
So that's what FCT is doing. Before I go, I will share these things so that you can place them for the
that would be good.
FCT residents to see and decide which is the nearest vaccination center to their
abode and the rest of it.
So this is being done.
Okay.
Yes.
Thank you very much. Please, fellow Nigerians, you are listening, and I hope and I pray that you are listening well, because one of our problem is we do not listen well. The Ministry of Health is doing a lot of information dissemination. NCDC is doing loads of information dissemination. Here in the FCT, I have here with me Dr. Kawu, who is at the same time disseminating information to us, the people we can call we the Abujans. And he is doing that because there is a spike from last month to December. A spike that is over 1,000%. And what he is telling us now, in simple terms, is let us, for starters, obey the non-pharmaceutical protocols of wearing your face mask, of social distancing, washing your hands where available, using sanitizers where available. For God's sake, these are simple rules. These are simple guidelines. Please adhere to them. And then the next level, the PHCs where you can access your tests and your vaccinations, he is going to give us the details, and then we are going to make it a regular thing for you on a regular basis. But the major thing is you. He said something I will repeat to you. If you do not care about what happens to you, what about the next man? What about the next man who is not a young man, who is an old man, whose immunity by virtue of his age has dropped a little bit? Do you want to be the carrier? Do you want to be the one that will send him to an early grave? Please don't be. And that is where we have people like him here in the studios to educate us on a regular basis. My doctor, I would like to say something for us in Nigeria, and I hope you'll be able to tell us what we have been doing that has mitigated the numbers. I am not a morbid person. In totality, the number of deaths we have in Nigeria is just a little bit over 3,000. And lately, we've had 21 deaths when this Omicron became a factor. I believe that for the numbers to be that low, there is something you people are doing, both from your own level, back to the NCDC, back to the Ministry of Health. What is it that you are doing that is lowering the numbers that the people should listen to, should hear about? And then maybe we should come and clap for you guys that you are doing a good job. What is it you're doing?
Thank you very much. I'm sure everybody will be wondering, because if you look at what is happening in Europe and America and other places,
the numbers are very high, very, very high.
What is happening is like child play. I'm sure you are aware that WHO has adjourned Nigeria to have managed the pandemic extremely well.
Of course.
And we are adjourned to have. Now, there are so many things. The first thing is, I think, the federal government taking the leadership.
Okay.
Instituting the presidential task force first, then presidential steering committee, having national policies at the highest level.
That's good.
Where a decision was taken at the right time to close down the airports, stop people from coming coming in with the virus, and then spend so much in testing and also isolating, forcing people to get. You remember when it started? People were being bundled to isolation.
Isolation centers, of course, yes.
People thought the federal government was being too mean, but it turned out to be.
It has paid us. It paid us.
Yes, but I can also tell you, for the death, I think we have a demography.
Okay.
That is favorable.
That's true.
Yes,
That's true.
I think our population mostly is a youthful population compared to the West,
where they are older.
Older people. I think this also must have contributed.
Oh, that's true.
In addition to what the government did.
Okay.
And if you look at what is happening in Europe, and what happened here, definitely there are other factors which we strongly believe is demography.
That's true.
Yes.
That's true, of course.
Why you have young people whose immunity is very strong.
Very strong.
Who do not have comorbidities, unlike
underlying diseases as we speak.
So,
yes,
so
of
I think
course,
this also must have contributed. But we shouldn't rely on that.
That's
yes,
true.
yes. Because as a young man, you take this virus to your old parents in the house, and you go and get them infected.
That's true.
You won't, unless if you do test. You wouldn't even know that you had it.
Yes, some people are asymptomatic.
Yeah,
They have it, but it doesn't show.
Yes.
Many are asymptomatic.
Yes.
Thank you very much. And because it is important, information is key here. And then this morning you are disseminating the information to Nigerians, most especially Abujaans, if there's a word like that, you're giving it to us here in Abuja, that it's high time we do this thing accordingly. Because the spike that I mentioned, the figures that I gave you are Abuja figures. And in actual fact, the figures even supersedes Lagos, that has a population of close over 20 million people. That is why I am talking back at you, our viewers, here in Abuja. You have listened to Dr. Mohammed Kawu. He has given us the basics. The basics are what we should listen to. We need to listen. This is not a case for, this is a pure case of the heaven is going to fall. It's going to fall on us all. It's not a matter for one person. You might think you are young, which he said is a case of demographics. Maybe because of the heat we have here, maybe because of some few other things, that we don't have the numbers that are in Europe. But at the same time, he emphasized we should not be careless. Don't think because you are asymptomatic. Asymptomatic means you have it. It doesn't show, because your immune system overrides it. But if you go to somebody like your aged parents, whose immunity is low due to age, you will be transmitting these COVID to them. Because, like the doctor said, it is easy, because it's respiratory. Even while you're breathing, up, down, if you have it, it's there, it's coming out, you're taking it back, it's coming out, it's going on. So for God's sake, let us listen to good rules as posited by Dr. Kau. Listen to the Ministry of Health on a local level, on the federal level. Go to the PHCs that we have in Abuja. PHC means primary health centers. He has informed us they have the capacity to test you. There are vaccines on ground to administer to you. For God's sake, like my people say, a little word is good for the wise. If it gets into you, you extrapolate on it. Dr. Mohammed Kau, it's been our pleasure having you in the studio to share your insightful insights with Nigerians at large and Abuja as a people. And honestly, since like you rightly said, that COVID is not going, it's still with us and it will be with us for a short while, by God's grace. Honestly, I will call you again to come and give us insights, share your insights with us, give us the guidelines that we are going to follow so that those numbers can remain on a low level. Thank you for granting the occasion.
Just before I go.
Yeah, you give us your last word. Your last word is important too.
The vaccines are free.
Of course.
No additional, no hidden cost.
That's good.
They are available in the private sector, all the high volume private clinics, all the general hospitals, all the primary healthcare centers, and they are free.
That's
if
good.
Anybody has to pay a dime, please report those people to the authority.
That's good.
Thank you.
Thank you
God
very
bless
much.
You. Yeah.
You can hear that last caveat, that last word. He knows us, typical Nigerians. He is telling you it is your right to get vaccinated, and that vaccine is free. If anybody wants to fleece you for money, report him to the authorities. On that same note again, I would like to say thank you for honoring the invite. We will call you again, like I said earlier, because COVID is still with us. So whatever guidelines you have, whatever policies you're coming up with, it is our duty in the media to make sure that we propagate all those information. And honestly, it is your duty too, to make sure you bring the information to the people. Thank you for being part of this program, my brother.
Thank you, and God bless you.